Good morning. Welcome to Parent and Family Orientation. My name is Karen LaTurner, and I work for Student Disability Services, which is a department in campus and student life. I'll just be talking to you for a few minutes about students who have a documented disability and need accommodations while they're here at the university, or what you should do if your student at some point develops a disability or thinks they may have an undiagnosed disability. Our mission is to remove any barriers that would prevent a student from fully participating in every program that the university offers, whether that's a class or anything else along those lines. We're here to make sure that they have full access to everything that the university offers. I just want to briefly mention that there are three types of disability. There are students who have a physical disability, students who have a learning disability, or psychological disabilities. So something that they would need to seek counseling for, or depression, anxiety, all of those things fall under disability status. So if your student struggles with something like that, in addition to receiving counseling services, they can also come speak with me and we can help them manage the academic piece as well. If your student has a history of having received accommodations and they have not yet registered with my office, please encourage them to do so sooner rather than later. If they used accommodations in high school, it is highly likely that they will want to use those accommodations here at the university as well. There is no guarantee that just because they received accommodations in high school that they will automatically receive accommodations here. We operate under different federal regulations than K through 12. However, if they did receive accommodations, it's likely that they will be approved for some type of accommodation here at the university as well. This is a bit of a process in order for us to collect all of the appropriate documentation to make sure that everything is in place. We do have a rigorous process for making sure that, that the student meets the requirements for eligibility for receiving accommodations. We say that it can take up to 10 weeks. That depends on the complexity of the student's situation and how quickly I receive the documentation, to be honest. I understand that we're on a quarter system, which is only 10 weeks long, so if they were to start today, they wouldn't receive accommodations till the end of the quarter if we went strictly by that, but that's not the case. We work as quickly as we possibly can to get your student accommodations. If they have a history of having received accommodations in high school, but say their documentation is out of date and maybe they need to have some updated testing, please have them come see me anyway, right away. Very often we can provide provisional accommodations to get them through this first quarter while we're getting updated documentation. So we don't want them to be struggling through that whole first quarter. I will certainly work with them. So what they would need to do is meet with me. We would talk about the nature of their disability, the type of accommodations that they've received in the past, the paperwork that, that I would need from them, go over their class schedule, figure out what kinds of things that they're going to need. Once they are approved for accommodations, then they will receive a letter that says, you know, they receive X, Y, and Z accommodations. They should understand that I am the only person in the university who works with the undergraduate students in terms of receiving accommodations. So all of their documentation, testing results, everything, that comes to me. I am the gatekeeper of that information. I will share that if necessary with the director, and then we do have a consultant that if they sign the release form, I will share that with our consultant. That's it. As far as what their professors and their academic advisors are informed of, they will know that the student receives accommodations, they will know what accommodations the student receives, but they will know nothing about the diagnosis or the condition that the student has. We do what we can to maintain their privacy and confidentiality to the extent possible. So they should contact me as soon as possible, and we'll begin that process. Our office is located in the parking garage on the corner of Ellis and 55th Street. I know that sounds a little bit, but it's actually a lovely office. So if you've seen up on 55th Street, there's a gigantic new residence hall being built. There's a big crane there. And then a street over, there's the Ratner Athletic Center that looks like a ship. And right in between, there's the parking garage. We're in the little offices along the side of the parking garage, and we face the Ratner Athletic Center. So if a student needs accommodations, if at some point they think they might qualify for accommodations, but they're not sure because, like I said, perhaps they have a psychological disability or something like that, and they weren't even aware of the fact that that qualifies or can qualify in some situations for accommodations, come find me. I'll be in the parking garage. And my name is Karen, and I'm the only person that they'll work with, so they just come in and find me, and I will be glad to work with them this year and for the rest of their time here at the university. I'm going to turn the rest of the time over to Student Health Services. Then at the end, if you have questions for me, please come up and speak to me. I'd be happy to address individual questions and concerns at the end.
Thank you, Karen. Good morning. So my name is Alex Lickerman. I'm the Assistant Vice President for Student Health and Counseling Services, and I'm going to speak with you this morning about how your student can access our services. Following my remarks, Marcy Hochberg, who's our Student Health Insurance Coordinator, will talk to you a little bit about insurance. Then I'll come back up and we'll spend the rest of the time answering your questions. So I always start by putting up the mission statement of the University of Chicago Student Health and Counseling Service. And back in 2011, when I took the position, the first thing I did was actually travel around campus listening to students and taking feedback from them about how our services had failed to meet their needs and expectations in the past. And I put this up here to tell you that this mission statement was crafted from that feedback. And what was very clear that we heard from students was the most important thing that they need from us is access. And a student-centered approach. We're really focusing on giving them the very best care. And in fact, after we crafted that mission statement, we then went on to decide what values did we want to represent to students when we're caring for them. And this is what we came up with. And I put this up here not to show you or to suggest that, say, confidentiality is sixth in line behind the other five. But in fact, we actually had T-shirts made up of these, which my staff wear on Fridays. And the expectation that I have of them is that in every student interaction they have, they embody these values, and so that we can actually continue to respond to the feedback we have received from students. So this is a new slide I put up here now because it can be quite confusing about how student health services are paid for by students on campus and what each component of that payment buys them. So I want to be very clear. Your student who has registered and is now about to attend classes here has already paid the student life fee. It is a part of their tuition bill. And that student life fee gets your student unlimited access to student counseling, student health, and health promotional wellness. So whether they come in to see us literally 365 days each year or once, they get unlimited access to visits in our respective centers. Now, it may be that when they come in that's all that they'll ever have to pay for the particular problem that they have, that they'll meet with the physician who will diagnose them and recommend treatment. Or it may be that when they come in, they need some subsequent testing. So they may need an X-ray. They may even need a referral to a specialist like a dermatologist or a gastroenterologist. When that happens, that's when the student's insurance will be billed. So the student life fee does not cover X-rays or specialty referrals. That's why their students are also required to have insurance. But the point is here, if they're a registered student, by definition, they have paid the student life fee. By definition, they can come to see us in counseling and in health an unlimited number of times. They don't have to worry about that. Okay. Here's who we are. We're Student Health Services, as I said, Student Counseling Services, Health Promotion and Wellness, which I'll talk about as well. We also have an insurance coordinator, Marcy, on campus, as well as two representatives from United Healthcare, who underwrites the student health insurance that we provide, and the pharmacy. And here, in fact, is a map, which unfortunately is small and for some reason turned on its side, but I want to orient you a little bit. The roads down the left side here, that's the Midway Plaisance. That's literally the roads that are right out those windows there. So where we are right now in this room, we're about here. Okay. So first notice across the Midway, in the yellow yellow box on the slide there, that's the Woodlawn Social Services Building. That's where the health promotion and wellness staff are housed, as well as Marcy and our two insurance coordinators. If you travel across the Midway to the H, that's in the blue, that's the hospital. And the entrance to the medical service is off of 59th Street. And this is a great reason to go in here when your student needs help with a medical issue. One, there's an information kiosk literally in front of that entrance, and the people there can direct your student literally around the corner to where we are. The other reason is that there's many other entrances to the hospital. But if your student takes one of those, it's entirely possible we will have to send out a search party and end up coming across their cold, dead body, because the hospital is an incredible maze and very difficult to navigate. So we really encourage students to enter in the entrance I point out on 59th Street. At the very top of the slide, you can see where the plus sign is. That building is the DCAM, stands for the Duchossois Center for Advanced Medicine. That's where the university's outpatient clinics are, but we highlight it on the slide because it's also on the first floor where there is a pharmacy that students can go and pick up medications that's either prescribed or over the counter. And students love that. It's very close, as you can see, to where the clinic is, and it's easy to go over once we prescribe the medication and pick up the medication from that pharmacy. We have the capability of electronically prescribing to any pharmacy in the country. There's other pharmacies in Hyde Park your student may prefer to use. We direct those prescriptions wherever your student tells us to. And way down at the right bottom corner of the slide is the counseling building where the counseling service lives. They're in what used to be the old alumni house. It's actually a beautiful space, very warm, very welcoming, and very confidential. All right, I want to tell you a little bit about how busy we are. On the left-hand side of the slide, you can see the utilization data from 2013, 2014. I apologize, we don't have this most recent years of data all collated yet. It turns out not to be very much different from this. But you can see in counseling we had almost 13,000 visits. Now, keep in mind that the University of Chicago is 2/3 graduate students, 1/3 undergraduate students, so this is not all undergrads by any means. What has been increasing over the last couple of years is not the total number of visits, but the number of emergency visits. I'm going to talk about that in a later slide. On the right-hand side of the slide, the student health service utilization data, if you go down to the bottom, the total visits, you can see we see just about twice as many students in the medical clinic as we do in the counseling clinic, partly because the issues are different. Counseling also schedules their appointments every 50 minutes. We schedule them in the health service every 20 minutes because medical issues tend to be something we can address more quickly than psychological issues. That's how many we see over in the medical center typically. So I'm going to tell you a little bit about the counseling service. So here's our staff profile. This slide, unfortunately, is not entirely up to date. We just recently lost 2 of our psychiatrists at the end of the summer, have departed, so we're a little short on psychiatrists, but otherwise it's accurate. This slide reminds me to tell you about a project we initiated 2 years ago where we now send satisfaction surveys to every student who comes to visit us in the counseling service and in the health service. And the reason we do this is because the student's voice really does matter. In fact, on every page of our website, there is a button that if you press that asks for the student's feedback, and we read every single one of those messages sent to us, and in fact, we reply to every single one of those messages. And in fact, over the 2 years in which we've been getting that feedback has informed many of the changes that we've instituted. And I want to tell you about this, which is the most recent satisfaction survey results for counseling. Because if you look on the left-hand side, you can see the domains of questions we ask students to tell us about their satisfaction. So at the very top, because you may not be able to read that, it says your confidence in this clinician's ability to provide optimal care, followed by amount of the time this clinician spent with you, and on down. If you look to the right of the slide to look at the percentages in green, those are the percentages of students who were either satisfied or very satisfied with the service they received in each of these domains. Now, I put this slide up here not to give myself a big pat on the back and tell you what a great job I'm doing, but in fact to point out that 2 years ago when we started this survey, the percentage of students who were either satisfied or very satisfied with us in those domains were hovering around the high 80s, low 90s. You can just hold the question until the end. I'm happy to get it there. Now, you can see they've increased, and we think the main reason that's happened is because we have changed our services in direct response to the feedback that students themselves have given us, and we'll continue to do that. So what types of services do you get in the student counseling service? So the first thing I need to tell you about, and the most important point, is that there's no waiting list. So this is in actual contrast to most other college campuses in the country, so that if a student calls up the counseling service and says, I am not doing so well, I'm either horribly anxious or depressed or whatever may be going on, the person who they're talking to at the other end of the line is going to say, okay, we can see you within about a week. And at other counseling services across the country, that is typically not what the student would hear. They would hear, we can get you in within a couple of weeks to a couple of months. But we have really heard from our student body that access is so crucial. We actually agree and believe that it's so crucial. So we have been a lot of resources dedicated to getting students in quickly. And if in fact the student then says, well, you know, I don't think I can wait even a week. I'm really in trouble here. What they're going to hear from the other person at the other line is, then why don't you just come in right now? We have 24/7 emergency call. It is initially, the initial responder is a psychologist or a social worker, and they have a psychiatrist who backs them up, and then the psychiatrist is actually backed up by the counseling director himself. We provide diagnostic, brief psychotherapy, and referral services. By that I mean we will make a diagnosis if a student is diagnosed with depression or anxiety, or something more serious like bipolar disorder or even schizophrenia. We make those diagnoses. We provide brief psychotherapy. So I want to make clear, when the student first calls the counseling center and they're talking to someone and they make that first appointment, therapy is not going to go on at that first appointment. That's what's called an intake appointment, where they'll be talking to a therapist, but the job in that appointment is for the therapist to figure out what is the nature of the problem and what are the best resources to help the student. So sometimes the answer is going to be, we're going to bring you into our counseling center here, and we're going to see you for a brief amount of time to help you with your problem. In fact, mostly that's what we do, because most of the problems that students call up with are absolutely amenable to brief psychotherapy. But if it turns out to be a problem that is going to require more long-term therapy, it's a more deep-seated issue, and it's not necessarily an emergency, but something more chronic, almost certainly we're going to refer that student out to one of our counselors in the community. At that point, the student's insurance would begin to be charged for those visits. If the student has the student health insurance specifically, and we refer them to one of the providers in that network, we've negotiated with them and worked down so that the copay, meaning the amount the student, him or herself, is required to pay out of his or her pocket, is only $10. We also, in the counseling service, and again, remember, if they stay in the counseling service, that's already covered by the student life fee, so that brief psychotherapy there's no extra cost for that. But we provide individual therapy, which is typically what students think about, but many don't realize we also do couples counseling, and in fact, we also provide group therapy for certain issues around which group therapy has been found to be helpful. We also provide medication management. So if you remember back to a slide or two when I put up the components of our staffing, we used to have 5 psychiatrists. We're now down to 3, although we're looking to hire those 2 extra in. The reason that's so important, we're unique this way. Most counseling centers around the country at other colleges don't have even 3 psychiatrists. But what they're able to do is provide medication management to students who are here with more serious mental illnesses that require medication management. So in the past, really, students who had severe bipolar disorder or schizophrenia really were not capable often of making it at college. But now, because we have such amazing medications and treatments, they are now coming to colleges and not just surviving, but actually thriving. But that medication often requires management, adjustment, and monitoring, and that's what our psychiatrists will do, and they'll do that throughout the entire 4 years of a student's career here. We don't typically refer out for those services. I will confess that with the reduction in our current staffing, we're going to have a challenge getting people in a timely way, but we're looking to fill those positions and are still committed to providing that medication management to students who need it in-house. Let's Talk is a program we stole from Cornell. It's a really great idea where, I don't know if you remember, when Lucy was sitting with Charlie Brown and a sort of the psychiatrist is in little stand just hanging out. We have at various sites around the campus counselors who literally every day just go there and sit and wait for students to walk up, sit down, and even without telling us their name, just begin talking about whatever problem they may be facing. The idea here is, especially for some students maybe who are from other cultures, who are not as comfortable coming to a professional for mental health issues, and frankly, even many Americans are not comfortable doing that, we're trying to figure out ways to lower the barriers to entry, because in fact, the major barrier to for students getting mental health services is often within the student themselves. So here is an anonymous way to come in and just begin talking and feeling out and talking to someone who has training about issues that your student may be having. We know that this is successful because when you look at the data, a number of students who end up coming to counseling service actually come through the Let's Talk program. So we really encourage students to come and make use of that. Finally, we have an academic skills assessment program where if students are having difficulty, say, organizing their studying habits, or they have problems with procrastination, or anything that centers around study and work in schoolwork, we actually have people who are trained to help them with that. In fact, sometimes what we often discover is when students come into this program because they're, say, having trouble with procrastination, for example, the problem is not actually that they're procrastinators, the problem is that they're, say, horribly anxious or depressed. So we actually, in fact, often make mental health diagnoses in students who come into that program, but we have that available to students as well. I'm going to shift gears now and tell you about the medical service. Here is our complement of staff, and in fact, I'm delighted to say we're finally fully staffed and are easily able to meet our appointment standard, which I'm going to tell you about on the next slide. Here is the satisfaction data for student health, and again, the questions we ask are a little different because we're a medical service, not a counseling service, but if you look again on the right-hand side of the slide, you can see that most of our satisfaction scores are in the mid-90s, mid-high 90s. Again, when we began 2 years ago, high 80s, low 90s. We've ticked upward, we think, again, as a result of listening to the feedback that students themselves have given us. So here are our services. The first thing to know is we have an after-hours nurse advice line. It is open and available when we are closed. And the nurses are actually quite good. And when students don't know what to do, they have a problem in the middle of the night, they call this line. They may be told, don't worry, take an aspirin and come see the physicians in student health the next morning, or they may be told, go to the emergency room now. It's very interesting how often students who don't think they need to go to the emergency room actually do and are need to be told that, and students who think they need to go to the emergency room actually don't and are told that. But we really encourage students after hours to make use of this advice line. We have an acute appointment service standard, and by that I mean we are a by appointment only. So you pick up the phone and you call our clinic and say, I'm having X, Y, and Z symptoms, I need to be seen. Our standard is to offer an appointment within 24 hours, and in fact, we try to do that within 12. And last year, in fact, when we looked at the statistics on that, we were able to meet that standard 100% of the time. Now, that does not mean the student actually comes in for the appointment within that time, because often what happens is the student says, when we say, well, we can see you at 11 o'clock, the student says, oh, you know, I can't, I have a class at 11 o'clock, I can't make that. Okay, well, we have something at 2 o'clock. No, that doesn't work for me either. Okay, well, we can see you on Friday. The student hangs up the phone and says, oh, they couldn't see me till Friday. Well, that's true, but it's not for our lack of trying. And so, in addition to try to improve the flexibility of our scheduling process, 2 years ago, we actually instituted a walk-in clinic. I will make very clear that does not mean we're expecting or asking students to just walk in. You still have to call for an appointment. But if the appointments that we offer you will not work for your student, we will then offer, as long as there's spaces still, we reserve these spaces every day for a walk-in clinic staffed by one of our physicians. And we will tell the student, you can come into the walk-in clinic, but be aware it's first come, first serve, so you will have to wait. But students actually really like this because they always have work to do, they bring it with them and they just wait. But they may be waiting several hours, but we guarantee we will see them in the time that we have allotted for that. So they've been very pleased with this. It's actually increased our scheduling flexibility. We also now have Saturday hours. 2 years ago we instituted hours, so from 9 to 1 on Saturday we're open as well. Okay. Health promotion and wellness. So I want to make clear, health promotion and wellness is not a clinical service. So if a student gets into trouble with some acute issue, whether medical or psychological, it's not health promotion and wellness that will deal with that. Health promotion and wellness, and you can see the complement of staff they have here, their job is actually to promote health and wellness and prevent disease. They are predominantly an educational service. This year, however, we're actually moving into a new arena of public health with a program we're calling FACETS of Wellness. And the idea is this. Studies really clearly show 80% of all our behavior is done habitually. That is, we're doing it without thinking about it. We're thinking about something else. So from maybe leaving a room and flipping off a light switch to getting in a car and automatically putting on our seatbelt, we are not consciously thinking about doing these things. Our environment is triggering those reactions in us. And studies are very clear on this, that you can have environments that trigger healthy behaviors and environments that trigger unhealthy behaviors. The public health model seeks to affect the environment at every level, the level of the individual, the groups, the community, society, by changing the environment in such a way that promotes healthier behavior. And we want to do that here in all these different facets, in the social arena, the emotional arena, environmental, intellectual, and on in that way. So this is a long-term project. It requires sort of the cooperation of all the various different silos that exist at the University of Chicago. And so Julie Edwards, who's the Director of Health Promotion and Wellness, is working very hard to begin to affect policy and actually create an environment that really promotes student health. Programming has not gone away, however. We still have interesting programs, one of which is called Pet Love, where actually we bring in dogs for students to pet. Sounds kind of funny, but in fact, last year, one quarter, we had about 700 students line up to pet the dogs. It's an extremely stress-reducing experience. We also teach, mindfulness meditation. We have large-scale events as well, something called Wellapalooza, which is like Lollapalooza, except instead of music, it's a health fair. Uncommon Nights, it's a social event for students who want to have fun without alcohol being present, and so it's a non-alcoholic alternative to social hours. And then we have customized workshops, something called the Body Project that works with students who have issues surrounding body image. In Touch is a group that educates about sexual health, sleep education. This is a neat thing, a very new thing. We have an email program that actually we piloted last year for students who are struggling with sleep issues, which, as you can imagine, is a very prevalent problem here. So very successful. We're going to be enlarging that this year. Stress management, many workshops involving teaching students how to manage stress, and then Be Wise, Be Well, educational topics on, or educational initiative on many topics. We have new programming this year that we just piloted this summer called Mental Health First Aid. So this is training that we have given to our own staff, and we'll be moving out to other staff in the university. The goal of the training is to teach them to recognize when students are in mental health distress. And then not, of course, begin counseling them, but actually connect them to resources on campus. We are continually challenging ourselves to figure out ways to lower the barrier of entry to mental health services. There are many reasons, and we actually know them because we've surveyed students and understand why students who need mental health services don't go access them. Huge variety of reasons. And we're always trying to target those, but one of those is actually students themselves don't recognize that they are in a level of distress that could be benefit from mental health counseling. And so having bystanders recognize that and often tap them on the shoulder and say, hey, I recognize you're in some distress here, and there are resources on campus that can actually help you. Let me help you get to those resources. We're very excited to pilot this year and expand it to see how it goes. Okay, I think that's actually the last slide that I have. So now what I'm going to do is turn the presentation over to Marcy Hochberg. We're going to talk with you about insurance questions, and as I said before, when she's done, I'll come up and we're happy to answer any questions you may have. Thank you.
Good morning. My name is Marcy Hochberg. I'm the University Student Health Insurance Coordinator, and I want to talk to you this morning a little bit about the university's requirements for student health insurance. So one of the things that I've learned in my position, I've been doing this here at the university for about 2¼ years, is that pretty much no one understands health insurance in America. So let's try to demystify a little bit about what the university requires, and then we can talk a little bit about what's going to be the best fit for you and your student as far as health insurance. So the university requires all students to have good health insurance. A couple of years ago when I started doing these presentations, my slide actually used to say adequate health insurance, but we live in a post-Affordable Care Act landscape these days, and so I've actually upped the requirements. The University of Chicago is always improving what we require of our students, so now my slide says good health insurance. So let's talk about what that requires. So to that extent, what we do, whether you like this or not, we've gone ahead and we've enrolled your student in the University Student Health Insurance Plan. I'm going to start calling that USHIP because it just takes too long to say University Student Health Insurance Plan over and over. So, and we do this every year. So this is important for you to be aware of, because every year what this means is that your student needs to make a choice. This is their open enrollment period in student insurance land. So they need to either determine if they want to use USHIP for their coverage, which is great. What we encourage them to do, because this is our open enrollment period, is I want them to go to studentinsurance.uchicago.edu and confirm that enrollment. Because the university has enrolled them in the plan, and they are covered, don't worry. However, we haven't sent any data to United Healthcare yet, because we are in open enrollment, and we're not going to do that until we've reached this deadline period. So if they don't do anything, although they do have this coverage, United Healthcare does not know that they're an active enrollee in their system. So if they do want to use USHIP for their coverage, don't worry, they are covered. But if they're going to be using USHIP, what I want them to do is go to studentinsurance.uchicago.edu, confirm that enrollment. What that means is we're going to send that data to United Healthcare. United Healthcare will know that they're an active enrollee in their system. 48 hours later, they will send them information about how to set up an account in United Healthcare system, to download their insurance ID card, and to have access to all of their insurance benefits. This will happen by default after October 23rd, but if they need to use their insurance before that time, United won't be able to recognize them. They are covered, but United won't recognize them, and this could create a little bit of confusion. So if they are going to use USHIP, please have your student go to studentinsurance.uchicago.edu. They're going to log into our system with their CNET ID and their password. It'll take them 3 minutes. We want them to confirm that enrollment. Conversely, and I think this is actually going to apply to most of you, it's very likely that most of your students are already covered under your insurance coverage, and you would prefer that that stay that way. So what your student needs to do is actually waive their enrollment in USHIP. And in order to do that, we're going to ask that, remember, we come back to this, we want them to have good insurance, and I'm sure that's the case with most of your insurance. But in order to waive, we're going to ask them to affirm that they've got good insurance that has comparable coverage. Now, what do I mean by comparable coverage? Well, first of all, I've actually got a checklist that outlines what that means, and you can download that from our website, but I've also got some copies of that printed out over on the side. Feel free to grab a copy when we're done over here. But what this means is that we want to make sure that your plan provides a certain list of benefits that are comparable to what the university plan is providing. Most of these are aligned with Affordable Care Act requirements. So in most cases, if your plan is an ACA compliant plan, you're going to meet our requirements. The other thing to point out, though, is that we want to make sure if you are coming from out of state, that your plan is also providing not just emergency care, but non-emergency routine care in the Chicago area. So there's a few other requirements that need to be met. Most of them are tied to ACA standards, but we do have a list of requirements. Your student is going to go to our site, studentinsurance.uchicago.edu. I highly encourage them to do this with you beside them, and with you having information about your plan, because we're going to ask them to basically affirm a whole list of points of information about your insurance. In many cases, if they try to do this by themselves, their head's going to explode. So I encourage you to sit with them, review your insurance, go through the form, and we're going to ask them to waive out of USHIP. We want them to make sure to do this before 5 p.m. Central Time on October 23rd. And I really encourage you to take care of this before that date, because again, the form can be somewhat complex. And not just that, right now, many of you may have already experienced that the first billing installment for USHIP is already on your student's bursar bill. As you know, this is going to go away, but the sooner your child waives out of USHIP, the sooner that charge is going to get off of their insurance, off of their bursar bill. So if you have any questions, I'll be happy to answer those later. Let me return to this point about the student life fee. Dr. Lickerman raised this earlier, but I want to reiterate this because this is really important, and this tends to be a point of confusion for students and then sometimes for parents as well. As we indicated, students, each quarter that they're registered, pay a student life fee. This gives them access to campus health services, as well as to the library, to a number of student activities, a number of other services on campus. But for our purposes, what we want to affirm is that whether your student is enrolled in USHIP or whether they're on your insurance, they have access to student health service, to student counseling service, and to all of those wonderful health promotion and wellness programs that are going to keep them healthy and well and not needing to access their insurance. So we want to make sure that they know that if they're not feeling well, if they're feeling anxious, if they're feeling stressed, that they know that they can come to student health service, that they can come to student counseling service and take advantage of those services, and those are available to them free of cost. Now, for those students who are going to be using USHIP for their coverage, I just want to point out a couple of points about how the plan is structured to make sure those of you who are going to be using this coverage are aware of how it works. The plan is set up to be integrated with campus health services. So we ask that if you're using USHIP for your coverage, that you start at student health or at student counseling for your primary for your primary medical and mental health care. If you then need to access additional specialist care, we want to make sure that you've started at student health or student counseling to then have a referral put into their system first before you access these specialist care. So let's say you know that you have an ongoing chronic condition and you want to see a gastroenterologist. Start at student health first. They're going to note this condition and they're going to put a referral into their system and then refer you to a specialist, whether it's at the University of Chicago Medical Center, or let's say you have a specialist you've already been seeing elsewhere in Chicago, ideally someone who's already in United Healthcare's network. Once that referral is in the student health system, you are free to go and access these specialty services as you need them. However, we want to make sure if you're using UChip that you have gotten this referral in student health system, or similarly, if this is for an outside referral for psychotherapy, that this referral is put in student counseling system. If the referral is not in the system, students are going to be charged $50 per point of service each time they go and see that outside provider. Now, if your student returns next year and remains on UChip, they do not need to come back and get a new referral at student health or at student counseling. This is one referral per condition for the entire time they remain on the plan. But they do need to have that referral in student health system or in student counseling system in order to avoid fees that they don't need to be paying. So I bring up this slide to just make you aware of the cost of UChip. This is typically the point at which students tend to choke when they see what it costs. But we point this out because we do a lot of education with our students. For students who are using UChip, many of our grad students use UChip while they're here. Many of our undergrads tend to waive. But we try to make a point of helping our students understand that when they're doing insurance education, whether they are, whatever plan they're using when they're here, that we want them to understand for here and beyond, what are the best ways to start to assess insurance for their own health needs? And for many of your students, they're covered under your plan. This is not something they need to worry about. But further down the road, when they graduate, they may be in a position of aging off of your insurance, having to look at alternate plans, and we want them to think about what's going to be the best way to make an assessment for their needs. So let me move forward and just review 4 points of terminology that we actually go over with students at various points during their UChicago education. Because we want to make sure that when students are thinking about insurance, that they understand at least 4 points of terminology so that they can understand how to think about insurance needs, whether they need to make this assessment now or several years from now to think about what's going to be the best fit for their needs. So for all of you, and again, you're paying these costs, many of our students don't think about these things until they actually have to have these considerations. So the premium, and you just saw that sort of ugly-looking premium for UChip. The premium is how much it costs to actually buy your insurance. And again, most of the students who are on your plan, they're not thinking about this because they're not paying for their insurance yet. But that next cost, a deductible, again, for many of you, if your student is on your insurance, they're not going to think about that. But let me tell you, many of our students, when they age off of your insurance, or the first time they switch to a plan that they're paying for themselves, many of our students are shocked to learn that there's such a thing as a deductible on their health insurance plan, or that they have to pay any cost up front before their insurance starts to cover their medical expenses. So we want them to be aware of that there is a deductible, and the fact that, when they're choosing a plan, how high that deductible is might be a factor in how they assess what plan they choose. We also want them to think about an annual out-of-pocket maximum. Now, a number of years ago, before the Affordable Care Act, if you had a sudden medical situation, if you had a medical condition that came upon suddenly, or you stepped off the curb and got hit by a bus and you had a very bad medical year, you could have had out-of-pocket expenses that could have bankrupted you. Now, thanks to the Affordable Care Act, an individual plan limit this year has to be set at $6,600. Ideally, that's not going to bankrupt anyone. But when you think about what annual out-of-pocket maximums can be set at, they vary very much from plan to plan. And this is another factor we want students to consider when they get in a position to evaluate external plans. Finally, you want to think about what's your coinsurance. what portion of your medical expenses are you responsible for? Is it 10%? Is it 20%? 30%? Or even as high as 40% of your bills are you going to be responsible for paying? So let me put this in the context of USHIP. So you start to see a little bit about how the plan is structured a bit more concretely. Again, you saw that ugly premium. We charge you $3,432 to buy the plan. Why does the plan cost what it does? Well, let's look at the deductible. We have a very low deductible associated with the plan. It's a $500 in-network deductible, a $1,000 out-of-network deductible. Remember, I just mentioned the Affordable Care Act says annual out-of-pocket maximums can go as high as $6,600. USHIP is remarkably low. If you have medical expenses over the course of a year, once you've paid $1,500 out of pocket, the plan is going to start to cover you for 100% of your medical expenses. So here's where you start to see where you're recouping a little bit of that deal. Here's what you're paying for. You're getting a very good coverage and some very good rates. Finally, USHIP is rated at a platinum actuarial level. It's the highest rating that you can get for an insurance plan. It covers you at 90% of your medical expenses, so you're responsible for 10% of those costs. Prescriptions are paid at a 3-tier setup, so your prescriptions are either going to be you're either going to be responsible for $10, $25, or $40. Specialist visits are going to be $20. And then finally, as we noted, if student counseling needs to refer students to an outside psychotherapist, those are going to be set up at a $10 copay. So we do, again, we've pointed out how these 4 factors interplay when you're thinking about assessing insurance. And again, this may be moot for most of you. I know for many of you who may have more than one child on your plan, it's still going to be more cost-effective to keep your child on your insurance. But as your child gets older, as they start to think about how do you assess plans, we have a slide that allows you to start to think about what does this mean? So we have USHIP compared to a plan on the Illinois marketplace, a Land of Lincoln PPO Silver plan. And then I also put up something called an ISO Care plan that's available to our international students. There's a whole cottage industry that's sprung up in the last few years for international students who are looking to waive enrollment in their student insurance plans, and they need to provide comparable coverage. So these are plans that are now available just to international students. Domestic students can't purchase these plans. They provide fairly good coverage. And they are US-issued plans that are sold to international students who are looking to waive out of student insurance plans. So here's my point. If the only thing you looked at was just the premium, both of these other 2 plans look much better than USHIP. If we now consider the deductible, the Land of Lincoln plan has a much higher deductible, but again, you're saving a lot on that premium. That might still be a tolerable, risk assessment that you want to make. But now we get to that out-of-pocket maximum. Both of those other plans are much closer to that annual out-of-pocket maximum that the ACA has pegged that limit at. And you see here's where that USHIP benefit starts to play in. Similarly, your coinsurance is a bit better. USHIP is covering you at 90%, so you're only responsible for 10%. In the other case, the Land of Lincoln plan is covering 70%. You would have to pay 30%. The ISO Care plan is covering 80%. You, as the enrollee, would pay 20%. So what does this mean if you faced an actual medical bill? So let's think about being at UChicago over the course of a year. We have 6 months of winter. You're running across the quad, you're late for your class, you slip on the ice. Uh-oh. So let's think this might be that first MRI that you're responsible for. Because people always underestimate, and our students particularly underestimate the cost of healthcare in America. So this is your first bill. And so now let's think about, we have to cover our deductible first. So let's think about, we've got that $5,000 bill. Let's subtract that deductible of either $500 for USHIP or the ISO Care plan or $1,500. Now I'm responsible for either 10% of the remainder or 30% of the remainder or 20% of the remainder. So now when I look at what I actually have to pay out of that $5,000 bill, suddenly the value of USHIP relative to these other 2 plans starts to look a little bit better. So we put up this slide mostly to help students start to think about and to give you a sense of how we start to think about the relative value of different insurance plans, and how you start to think about what's going to be the best fit for particular health needs. Again, given that, this is just that first MRI, I'm still thinking about my, physical therapy bills. I want to consider also that I'm much closer to my out-of-pocket maximum on USHIP in this case than I am on these other two plans. So this might be something down the road as your students are thinking, as they start to consider having to assess other plans. We want them at least to begin to think about not just the premium cost, but what's the deductible going to be? What is that out-of-pocket maximum? What's the coinsurance? And then to consider their particular health needs so that whatever their options going forward, they're going to be able to make the best choice for their particular needs. For those students who are on USHIP, we want to highlight the fact that we do have 2 United Healthcare on-campus representatives who are here to assist students in understanding the plan, understanding plan benefits, working through claims information. I want to introduce one of those representatives to you right now, Jan Thomas. She works closely with me. James Abernathy, our other representative, I think is at another presentation that's happening at the same time today. So they're both available to answer questions. They're also available at this time to help students confirm or waive enrollment through our online form. So if you are having some difficulty or students having some difficulty navigating the online application, please contact our office. We actually have sat on the phone with students and parents and just sat as they've filled out the form and made sure everything has gone through successfully. We're happy to do that with you. We're available in person, by email, by phone. For those students who are using USHIP, you will get information once they've confirmed their online enrollment through United Healthcare. We want them to set up a My Account. That'll enable them to download their insurance ID card, get information, but also check claim status if they have a pending claim. They can find network providers anywhere in the country. They can check information about pharmacy formulary and get other useful information 24/7. So access to their USHIP benefits is available to them whenever they need it through their online My Account. I also, because USHIP is a medical plan, we know that there are some students who additionally might need coverage with regard to dental or vision insurance. So whether your student is on your coverage or whether they're on USHIP, we provide information for students regarding optional dental and vision coverage that they can sign up for separately. This year we have information on 3 different dental providers. There's a Cigna HMO, a PPO that's offered through Delta Dental of Illinois, and then United Healthcare offers what they call a low plan, which provides students with coverage basically for cleanings and fillings. They have slightly different structures regarding how they handle coverage. All of this information is available on our web pages. If you go to studenthealth.uchicago.edu, and actually if you go to studenthealth.uchicago.edu/insurance, you'll find the landing pages for student health insurance. But if you go to 2015-2016 dental, you'll find information on optional dental providers. Similarly, if you go to 2015-2016 vision, you'll find information on optional vision providers. We have 2 providers with information on optional vision plans. They're both PPO vision plans. They each offer an eye exam, 1 eye exam annually, and they're, again, they're structured slightly differently as far as how they reimburse for eyeglass frames, lenses, or contact lenses. Again, all of this information, including premiums, is listed on my websites. You have links to summary of benefits, premium information, and links to the direct provider sites if you want to enroll your child in any of these plans.